So we're just going to go over and demonstrate how to remove an indwelling catheter now, and the supplies you need, and then what to do. So in this case as well, you'd want to make sure that there was a physician's order to remove the catheter. You'd want to explain that to the patient. So we've done that already. We've checked that there is an order to remove the catheter now, and that the patient can try to void on their own. The patient is aware of this and excited for this, so we're just going to clean our hands, and we are going to, for supplies, we're going to have clean gloves because there's likely contact with blood and body fluids, and then you'll need a 10 cc syringe, depending on how much the balloon was inflated with, but like we said before, it's typically 10. In our case, it's 10 mLs of sterile water. So your kit comes with a slip tip syringe, 10 mLs, which you can use, and you guys will have access to that commonly, so you could use that. But more commonly in a hospital or a clinical setting, you'll have access to a Lurlock syringe that's prepackaged and sterile. So you'd want to make sure that it was a new sterile syringe, not a used one, obviously, but just that you can deflate the balloon with either of these. So I'll maybe show you with a Lurlock because you already know how to instill fluid and inflate the balloon with your slip tip while you practice putting it in. So we'll go over it with a Lurlock. And the other thing is it's often a blue pad. Ours is a white pad, but some sort of absorbent pad so that, because it's likely that there's going to be urine remnants once it comes out, that you just kind of want to help keep it as clean as possible, the situation. So we will also empty the drainage bag at this point, dump and measure the urine that came from it, and record it accurately so that we know the last time that their output is accurate, so that once the catheter is out, we can start measuring just in a different way. So we've emptied our drainage bag. It's down here and it's all empty. So Mrs. Brown, we're going to remove your Foley now, as we talked about before. The physician has ordered it, and we're going to see if you can void on your own now. So we're just going to expose you. We've maintained your privacy by closing the door and closing the curtains again. We're just going to pull back your gown and your sheets here. So I'm just going to place the absorbent pad underneath you so that we don't, actually she has a soaker underneath her already, but we'll just place this pad for some extra protection. So this is it's not sterile removing the catheter, so we don't need sterile gloves, we just need clean gloves, again, to protect ourselves from the body fluids that we're likely to come into contact with. So with our Lurlock syringe, we're going to want to open it and discard this. And we're going to hook it up to the green port, the same port that we instilled the fluid in for the balloon. And it actually just locks in like the slip tip, but it spins on instead of just being pushed on. So you'll want to make sure that your balloon is completely deflated before you remove it, because again, that can cause urethral trauma and damage and lots of pain for the patient if you pull out a balloon that isn't completely deflated. So what you could even do is squirt this out, or squirt it onto your absorbent pad, and then try to again hook it up and see if more comes out. In our case, we did just fill this with 10, so I know that I have about 10 now coming out. You can just try to, if you pull back too hard on the balloon when you're deflating it, the tube will actually just eventually collapse like that. So then you'll just want to deflate or empty your syringe and just hook it up again and see if any more flows out by gravity. So no more flows out, we're good. So I'm going to actually just remove. Mrs. Brown, if you could take a deep breath in and out, I'm going to remove the catheter now. Might be a little bit painful coming out or uncomfortable. Great, it's out. And what oftentimes people do is you want to inspect the end of the tip of the Foley just to make sure it's all intact, that the balloon wasn't inflated, nothing broke off inside her bladder that's going to need to be removed surgically. But you now are just inspecting. Hopefully it doesn't look infected or anything, and you can unclip it here. And what people often do, like I was starting to say, is actually just take their glove off around it, because that part of the Foley that was inside the patient you wouldn't want to be handling. So you can just kind of do it that way. Whereas this drainage bag, and hopefully it doesn't break off, was outside the body at all times anyway. So you just then throw out the entire system, goes into the garbage. And we'd perform pericare on the patient because now they've had this would all go in the garbage. I'll just kind of put it down here for now. We'd perform pericare on the patient because they've had this Foley in for however long, and they're probably, we were doing pericare with the Foley in, but now we can kind of access the meatus a little better. So definitely just get them all cleaned up, make sure they're feeling okay, and now we're gonna document that we removed the Foley, the specifics of the situation of what size we removed, why it was removed, and what we're monitoring for now is the patient to void. And she would be due to void within 8 hours, because if longer than 8 hours, we'd be concerned about her maybe needing a Foley reinserted because perhaps she's retaining or not able to void on her own at this time. So we'd want to do further investigation into that. That's the basic idea or skill of how to remove a Foley catheter.